Hello and welcome to the HealthBridge podcast. This is your host, Holly B. Today, I am having an amazing conversation with a very unique person. Mark Mortiboys is a trailblazer in the dentistry industry since 1982. He embodies a revolutionary approach to oral and holistic wellness. As the founder of a special dental and health center of excellence, Mark pioneers a refreshing approach addressing the mind, body, and spirit trifecta through his dentistry. Through education and guidance, he empowers individuals to reclaim control over their oral and general health. So, Mark's unique approach to dentistry has earned him the title of dental shaman because he blends traditional practices with holistic healing modalities. By incorporating shamanic principles into his dental care practice and philosophy, Mark taps into a deeper understanding of the mind-body connection, offering transformative experiences for his patients. His innovative approach inspires curiosity, and it really opens new avenues of holistic wellness within the dental community. And that is why I wanted to have him on, because when it comes to the dental community, yes, it's becoming a little more common or a little more popular to be considered a holistic dentist. But what does holistic dentistry actually mean? For example, I think there's a lot of people that claim the title that aren't truly holistic in nature. They're really just maybe swapping out one product for another, but they don't really take this whole mind body approach. Mark really does take his practice to a whole different level. He really incorporates both the traditional Western dentistry model, but also really promotes the holistic lifestyle, the mind, body, spirit, energetic medicine as well, and sees oral health and overall health from that higher perspective of it's all connected, right? I think it's really easy for us as patients or even for dentists to see oral health as, yes, it can have some implications for other potential health issues that lead into other parts of the body, but for the most part, it's like this closed box. Things happen in the mouth, stay in the mouth, and that's really not the case, as we will find out in this episode. We will get into some really practical tips and hacks that you can incorporate into your daily oral health routine. But we are really diving into just that bigger picture view of what health really is, and then fitting that into a talk about oral health. So with that, let's dive into this episode with Mark Mortiboys. Welcome, Mark Mortiboys. I hope I pronounced that a little more of the
Correct.
English version. All right, good. Welcome to the show. I'm really excited to have this conversation with you. I, back in the day, would never think I'd be excited to speak with a dentist, but you're not just a dentist. You are a shamanic practitioner that combines these other modalities with modern dentistry. And
Correct.
yeah, I haven't come across that before. So I'd love for you to give us a little background into how that happens. And yeah, take that wherever you like.
Oh, wow. Real pleasure to be communicating across the pond. And I found out you're in San Diego, a place I really wanted to go to. So I'm going there tonight, which is lovely, spiritually, if not energetically, through this portal of the internet. And that's a big question. And I don't really want to talk about myself for too long. So I'll just give a very quick synopsis, because I'm sure people can check me out on websites and other kind of venues. Because really, that calling to be a shamanic practitioner and a shamanic dentist is still very raw with me. It's been like an undercurrent for 30 odd years, but I've been seen as very much a holistic, functional, kind of natural health dentist for the last 35 years. Ever since I came back from kind of world travels, I qualified so mid to late 80s, like 86, 87, and then 89 just took off. Just felt like there was a need to just explore the world. Certainly a lot of wanderlust after an intense period of life studying to being a dentist and then doing 2 years in clinical practice to sort of get some air miles up, so clinical miles going. And for me, it was like time out. Although I wanted to work with the Aboriginals of Australia, I was hoping to work with the Flying Dental Corps out there. It never happened. And in fact, probably just as well, because many other amazing things happened whilst I spent a year out in Australia. And then after Australia, with many rural experiences, being with Aboriginals, as well as just exploring an Australian lifestyle, which is to me a little bit like going deep south of the US or somewhere like that and going around where reservations are and things. Then had a 6-month period before coming home in the Far East. So the traditional places like Thailand, you may think, but it was mainly in Indonesia. And out in Indonesia was where I had many cosmic experiences that kind of created and opened me up to who I am today. But I've had a 35-year journey since then. And give you examples of the tribal life. So I found a tribe to live with in a little island called Siberut off Sumatra. And during that time, saw a lot of interesting practices. There was a senior man dying, and all these shaman came and did sacrifices to the full moon with chickens and things like this. So it was all very strange for, what was I was 25, 26, 27 of those days. And I was being exposed to that sort of life without internet, without any kind of communication systems to home, etc. I was very much on my own, other than there were a couple of other tourists that we'd met, one American and one Swedish guy in particular. And then somehow ending up in Malaysia with a fever that I feel maybe I caught when I was out in this island. And I actually had typhoid. And I ended up, thankfully, getting to a very remote hospital. And that's apparently where I died a couple of times. And from those near-death experiences, I've had that kind of awakening that a lot of people are talking about these days. I feel like 34 years ago, 1990, was when I awoke to my divine path, my cosmic journey, who I really am, my authentic self, whatever you want to call it, and came back to the UK, suddenly thinking, how am I going to turn all this into what I've been trained? Because I was trained in an amazing medical school, a dental school that's world-renowned, called Guy's Hospital, one of the leading hospitals in the world, let alone the UK, and had an amazing training that was very holistic as well, but still with some dogmas around fluoride and mercury fillings and things like this that I was suddenly awakening to, that maybe there's another way. There's an alternative way, or a higher energetic way of doing dentistry. And I wasn't ready to go straight into my own practice, but 24 years ago, in May 2000, I had the courage to actually open my own place. And from that time, I kind of worked with all the principles that we're going to share today. And in that sort of period beforehand, from when I came back to the UK, I worked in other clinics with other holistic dentists, and then got trainings from US dentists that were coming over to the UK back in the late 90s in particular, sharing information on airway, holistic orthodontics like jaw growth orthodontics, and how modern orthodontics is affecting our kind of facial structure, and giving us a nice straight smile but a smaller mouth, and maybe reducing our airway potential, let alone our communication potential with this orifice. And met so many people in my trainings that ended up wanting me to be their dentist. So I ended up gathering an amazing crowd of patients that had so much knowledge to share with me that I just stood on their shoulders and grew with all their kind of deep knowledge on nutrition, homeopathy, acupuncture, energy medicine, detoxification, etc., etc. And then I was always working with their patients as well. So it was like it had to happen that I had to set up my own practice, because that was all happening in this other practice. And I even got a TV show back in the late 90s as a holistic dentist. And I just got inundated. It was quite challenging back then to give guidance and advice. That was through PO box numbers. It wasn't through emails and stuff like that. So I had to write a standard kind of email, kind of letter, and then post it. How the world's changed in 30 years, right? And during the 25 years of having my own practice, I sold it 5 years ago, but still consult there. I give a lot of second opinions there and guidance. But I've kind of taken a back step, because I felt like during my clinical years, I had to keep my head below the radar. And since the whole 4-year escapade that we've all had to endure, there's a sense now for me that the time has come to speak my truth more in a very rational, grounded way. So it's not threatening to the mainstream, but hopefully it's guiding the mainstream to open their eyes, because I was hearing what I'm sharing 30 years ago, and I'm not really seeing a major shift within my profession. And I think it's just due to fear. It's due to fear. I think a lot of dentists, a lot of nurses, a lot of hygienists, they know this stuff and they have a sense of the stuff. They may even be doing it themselves, but they're afraid to go slightly against what's seen as the mainstream narrative that you must have more fluoride, you must have this, you must have that. When there's so much evidence coming to the fore now that we can work with other ways, more natural ways. And what I think is important is dentistry has always known the cause of disease up to a point. The main causes, what are those causes? But the dentistry is fighting an industry called the food industry that is so powerful and so potent, and has only, I think, really got stronger, because we're seeing now more and more processing of foods. If we knew 30 years ago that sugars and processed foods were the cause of dental diseases, or one of the major contributing factors, then it's only, in my world, got increased. There's definitely a movement away from that, but there seems to be an easier movement towards having more processed, refined foods. One, because it's cheaper. We're under economic stress right now, so more and more people are just cutting costs and deciding to just eat more of that sort of food because of price budget, but also convenience. We're stressed, we're busy. So I always see those kind of foods as luxuries that taste good once in a while, like a treat, like a fast food meal. It's like a Friday night. Let's just go a little bit AWOL and have some fun with some food and whatever else. Whereas I see a lot of people now living on this stuff. And maybe if we're not careful, we're going to start seeing, if we're not already, even more oral health diseases. Because I can tell you now, gum disease is on the increase. It hasn't gone away. Tooth decay has calmed down a bit thanks to many factors, and we can go into some of that today. I'm not convinced it's just about fluoride toothpaste, but just oral hygiene measures, going to the dentist more regularly, having more hygienists educating and helping, and toothbrushing, actually having equipment to keep our mouths clean. I'm not convinced we needed to use these products if we were healthy, but if we're unhealthy, we do need these products. We do need to keep the plaque out of our mouths if we're toxic. So that's a big subject on its own. Is ancient man never brushed their teeth. And if they did brush their teeth, they used plant products that had essential oils in them, like tea tree oil and miswak, all these kind of lovely oils that were antiseptic. And they just rubbed their teeth with like a branch or a stick that would break up into little filaments.
Yeah, licorice root works really well. Yeah. Just chew that up, and yeah, it works amazing.
It just reminds me very quickly how, I don't know if you're seeing this in your community, but more and more people are saying how they're spending so much money on vets these days, on their dental bills. And what's changed, back when I was growing up in the 70s, 80s, I was born in the 60s. I was 60, and what we today, like 3 days ago, I was 60. So you're talking to me as a sexagenarian. I can't believe I'm saying that. But so growing up as a child, my dogs always had marrow bones. They were never given they certainly weren't given chocolate treats. And occasionally they'll be given some of this filler, these kind of crunchy biscuit things. Whereas 30, 40, 50 years later, I can see that most dogs are eating that kind of food. And yet their tooth decay and gum disease levels have shot through the roof. And to take out a tooth of a dog or a cat is like a couple of $1,000s or pounds in the UK. And that's all I'm hearing. It's like, it's so much more expensive to treat dentistry for our animals, but they didn't have to do that 30 years ago, 40 years ago. And what's changed? It's purely the diet change, but not so much the diet in that it's processed, but the fact that it's not so frictional to clean our mouth. Because one of my tips I always give to people is, after sugary snacks, if you are going to snack on some crisps or some chips or some sugars, then as long as you put an antidote in there, it's like, I'm not going to okay it, but I'm going to say at least you've got an antidote. And those antidotes are raw, hard, sugar-free kind of foods, right? Or if they've got sugar in them, they've got certain kinds of sugar that are good for us. And we'll go into that, called xylitol. I don't know if you know much about the xylitol movement. But, like a raw carrot, out of a raw apple, they're fibrous. I think that's the key. It's like the fibers are your flosses. The fibers are your toothbrush. So maybe we should be thinking about going back to some more basics if we're going to live in this modern world at the same time. We don't necessarily have to live totally primally. We can have the best of both worlds. That's my message. That's my message to my dental community too, because I have been seen in the past as someone who's a bit left wing or right wing, when actually I feel I sit really in the middle because I've experienced both forms of healthcare or even sick care. And at the end of the day, they are just forms of healthcare. And there's pros and cons of each. And I feel like the real benefit of modern healthcare is for acute problems. If you've got you're in a car crash or you've broken your tooth, I don't think an apple's going to help that broken tooth, and it's certainly not going to help some broken bones in a car crash. You're going to need a top surgeon, you're going to need anesthetics, you're going to need surgical instruments, etc., etc. If you've broken your tooth, you're going to have it either filled or taken out, whatever's got to be done. But if you've got chronic disease, like you keep on getting cavities, or you've got a constant gum disease that sort of gets better when you brush your teeth, but never really goes away, is it an autoimmune kind of disorder that's very dependent on your own immune system? Is there more to this gum disease than meets the eye? What else is really going on? And do we need to dig deeper into the rabbit hole of you personally with your gum disease? Because I'm sure by default, 80% of the population, just by improving their toothbrushing and keeping their plaque levels low, they'll be fine. But they're like the people who will brush their teeth once a day or so and never get a cavity and eat lots of sweets. There's a strong group of people out there I've seen in clinical practice all my life that seem to get away with murder, dental murder. They eat sweets, they don't brush their teeth at night, especially guys. They come home late after a few beers, go straight to bed, don't brush their teeth, and they never have cavities. Yeah, and some of them even smoke, which we've seen smoking as a major cause of gum disease in particular, and maybe a risk factor for tooth decay because it can dry the mouth. So you may want to ask me a question because I could just talk all day. And I don't know if it's helpful to your listeners or not, me just rambling, but you can dial me down into some kind of specifics if you wish.
Yeah, there's literally like 100 different topics that I want to talk to you about. But
Sure.
Let's start because you were talking about the best of both worlds, being able to bridge that gap between Western and holistic in how we take care of our health and our bodies and our mind and our spirit. And that's the line that I walk as well. I think that taking care of ourselves on a holistic level is incredibly important. Western medicine is there when something happens that we can't handle on the holistic level or don't know how to yet, right? So for me, when it comes to my health journey, starting with mono way back 20 years ago, triggered chronic fatigue. Doctors are like, basically, I don't know what to do with you. It'll probably go away in 2 years. And I was like, okay, I'm on my own journey. Here we go. And eventually, and I learned so much along the way, studied herbalism, lots of just learning around nutrition and all these different things. And where I am now is that I'm realizing that we are so far out of how the human body really is designed to live and interact in a natural environment due to our amazing technology and the way we've set up our societies currently. I don't think that on a cellular level we have evolved to accommodate that yet without a lot of hiccups along the way. Yeah. And you were talking about some of that in what you just said. So I'd like to start with, let's actually talk about nutrition.
Great. Yeah.
I think getting back to that ancestral, more primal diet can be a big benefit. And I've seen that in myself. So can you talk about Weston A. Price? Because I think that he's one of the people that saw the benefits or appeared at least to see benefits in following a more primal diet versus this more industrialized processed food Western diet that seems to be causing havoc on our immune systems.
Yeah, I think it's interesting. He's called Weston. He's actually Canadian. When I researched him many years ago, and I think he died about maybe 80 years ago. So he was probably doing his work maybe 100 to 120 years ago, where he was just examining the physicalities of indigenous populations, from Eskimos to plains Indians, mountain Indians. He looked at different tribes and the common feedback, and he took loads of photography, or he had photographers that took his photography of just showing huge mouths which were uncrowded, I often say to my patients, I always say, send me your photos because let's see how your jaw shape is. And that's something that Weston Price really noticed was, and that with like the gold medal winners in the Olympics, they have huge airways, the sprinters, especially the kind of the fast burning athletics in particular. So say for example, the 100-meter sprint, the 200-meter, the hurdles, the winners of those, you just see their teeth, you see their mouth, their airway. They got such an unfair advantage on the rest because they're just sucking in air so easily. We talk about nose breathing and mouth breathing. That's another subject we can bring in today. But you'll see a lot of these sprinters, they're not even breathing. They just do a 100-meter sprint with one breath. You do see that with the swimmers as well. So having a huge airway was a natural birthright, it seems like, when Weston Price was studying indigenous beings.
And real quick, Weston was a dentist, correct? He was
yes, he was a dentist. Yeah. And the most amazing thing is that he's got more credentials than any other dentist. He's the most credentialed dentist ever. Yet he's not really known by dentists. It's really strange. It's like he's known more by the public because of the truth seekers, the health seekers finding this knowledge, whereas the mainstream dental world is not really selling this stuff. Again, we've got to question why. I don't want to be an antagonist, and I do feel like, as I said to you before we went online, I do feel like I have to give a bit of a disclaimer as a practicing dentist that really everything I'm giving is just for educational purposes only. It may not be true. I may be talking, sort of, I feel like I'm coming from a truth that I've done research and I've read amazing works from people and even research papers. I've read all this stuff, and there's a lot of informational sources to back up whatever I say. But I still feel like I have to give this kind of fiat, which is frustrating, really, because I just want to speak from my clinical experience, because I've seen it in practice. It's not something I've just read in a book. And I've got 35 plus years of clinical experience to back my anecdotal evidence up, let alone my colleagues who have similar mindsets. So I think you see what you want to see in life. It's what's your mindset? And if it's raining and you're positive, you're happy it's raining. If you're raining, it's negative, it just adds to the misery, right? So it's just a point that I feel like I have to say, but I don't really want to go on any more about it. I just want to know you all know this is just for education and fun. We're just having a chat. And please do your own research. And on my website, I'm building a portal of resources for people to get free information from. But Weston Price, not only did he notice big mouths, decay-free teeth, slightly worn teeth, or if not heavily worn teeth, that was a common denominator. And is that the trade-off for eating a fibrous, more unrefined diet? I wouldn't say it was always raw, but I think it was more. There was more raw food than not, because there was still a lot of meat eating that was cooked. So that one I can't really go too much into about the tooth wear factors, but I know in sandy areas where there's lots of coarse stone in the diet and maybe in the cooked foods, there weren't the filtration systems to take out that kind of stone and dust and sand. So we've seen that a lot in Egyptian skulls and really sandy based areas where there's a lot of tooth wear, really quite significant tooth wear you see in herbivores like horses' teeth and cows' teeth. It's a very flattened teeth. But the most important thing is very little disease of the mouth. I think if anything, the disease came from battles, from arrows and fists and rocks and tools of war being hit into people's mouths and teeth. So when you see his photography, and then he went down the rabbit hole of really exploring the indigenous diet, and he started to really notice that one of the key ingredients to optimal oral health seemed to be having more fat-soluble vitamins. He was very pro the carnivore diet, for sure. I wouldn't say he was 100% trying to say we should eat a carnivore diet. I think the modern message has always been meat and 2 veg. So that's going to upset the vegans. It might upset the carnivores. I don't know. But we are getting messages that might be correct, like meat and 2 veg or a balanced diet. And if anything, when I see really healthy vegans, they eat an amazing vegetable diet. We're not talking some baked beans and some toast. We're talking kind of quinoa and fresh this, fresh that. So they're super organic, eating just really, and a lot of raw and a lot of juice. And then the carnivores that are really healthy, they tend to be really watchful of what kind of meat they're eating. They're not eating burgers from fast food industry. They're eating kind of wild meats, maybe buffalo and venison and wild duck and wild animals that they're rearing in their own homesteads and things like that. so that it's more of a free-range organic diet. So there were many factors, but back in those days, there wasn't such thing as an unorganic diet. So I think we've got to question whether the genetic modification of our foods, our chemicalization with pesticides has really been that helpful. And a lot of nutritionists are saying we've never been so well fed, but so undernourished. So we're all scoffing loads of pizza and loads of this and loads of that, and we're always feeling full. And yet we're not so healthy. And there's a health crisis. It's not even a crisis. There's an obesity. There's a pandemic epidemic of health, obesity, diabetes, cancer, dementia, you name it, right? And dentistry has a huge part to play in this, sadly, because when we have the chronic disease of our gums, the bacteria and the organisms, the fungi, the viruses that are just kind of commensals of the mouth are ending up getting into our bloodstream and ending up in the organs. So that's, again, another subject once we've spoken about Weston Price. But I think his not just anecdotal evidence, he did a lot of very clever studies and looked very deeply into the nutritional ways of our ancestors, let's just say. And it's unequivocal that the optimal diet is very much unrefined.
Really quick, Holly B here. I just wanted to interrupt the podcast to ask you for a quick favor. Can you take just a moment to like and subscribe to this podcast on whatever platform you are listening in on? It makes a world of a difference. And the reach of this podcast, it takes like literally under 10 seconds. So go do that right now. Thank you so much. I really appreciate it. And now back to the episode.
It's not even that well cooked. A lot of it's raw and it's very unsugared. There's very little sugar. You could have some root vegetables that will have starch in them, but it's a low starch diet, not necessarily a zero starch diet. And there's a lot of fiber in that diet. So one, it was good for the digestive system and to keep the colon clean. But I also believe it kept the mouth clean. It may have worn the teeth down a bit, but that kind of fibrous diet, going back to what I was saying about dogs eating bones and bone marrow and just grinding and crunching foods, was actually the toothbrush. And maybe we don't really need toothpaste. It's a good idea nowadays because we're all so toxic. We can go into what are better toothpaste than others, because I do question some of the toothpaste that are out on the market with all the chemicals that are in. If we're sensitive and we've got allergies and autoimmune disorders, should we really be putting in to our mouths, which is one of the most absorbent parts of the body, should we really be putting in these kind of high chemical toothpastes? And we're not just talking whether we should or shouldn't have fluoride. It's just, should we have sodium lauryl sulfate? Should we have the saccharin? Should we have the artificial sweeteners, the propylene glycols? It goes on. If you look at the back of a toothpaste packet, it's quite extraordinary how that's so acceptable. And only a few people are questioning it.
And I go into the store to look at the toothpaste aisle and I'm just stand there bewildered. There's like an entire wall of toothpaste and 98 probably percent of it, 99% of it is just full of garbage. Really? So actually, can we dive into toothpaste really quick? Like when somebody is shopping for toothpaste, what should they look for? What should they hide from? And are there alternatives that you can recommend?
So in support of the current main players in the toothpaste industry, they've been pumping it out to us since the war. Tooth decay, they say, is going down, although in some parts we're now seeing it increasing. It's made toothbrushing popular because they're foaming and they're sweet and they're colored multi. You've got red stripes, blue stripes. So I don't think they've done any massive harm. But when you go down the rabbit hole of the ingredients, you think, okay, so these companies have now educated us that it's a wise idea to brush our teeth ideally twice a day. And maybe one day these companies will shift. And that's one of the reasons I'm on podcasts, is to say, look, I don't want you to die. I just like you to shift if you can, and maybe add another brand where you're going less synthetic or ideally zero synthetics for the patients and the clients of theirs that are sensitive. Every dentist sees regularly internal mouth ulcers coming from toothpaste. When people change their toothpaste, they get less ulcers, for example. We've all seen that as clinicians. We hear that about detergents in washing powders. You just got to change your chemicals and maybe go less chemical and you'll see improvements. So sadly, at the moment, the only way you can get a chemical reduced or chemical free toothpaste is to find independent, smaller companies that's generally not in the main stores. They'll be in the organic health food stores. So if you're not going to make your own toothpaste, because that's a big passion of mine, making your own toothpaste and playing with nature and plant medicines that can work very effectively at keeping our mouth biome kind of calm and clear, is to look in health food stores and firstly decide, one, what is your need? Because if you've got really bleeding gums, you need something with an antiseptic in it. And the traditional mainstream companies will have chemicals, and the organic health food versions will have plants with essential oils and herbs that will have these kind of optimal ways of managing the oral biome. And we've got to be a bit careful because some of these essential oils are too strong. And so there are some mouthwashes that I feel that are killing the good guys as well as the bad guys, even though they're seen as natural and organic and healthy. So we've got to do our own research, what's going to work for us. And after trying it for a month, if it's not working, then just because it's organic and natural, maybe think of trying something else. So are you using a toothpaste for gum disease? Have you got cavities? Are you getting constantly cavities in spite of your toothpaste? Should you be thinking of adding fluoride to your toothpaste? Or should you be thinking of adding the new wonder product, which is the natural ingredient of enamel, which is called hydroxyapatite? The jury is out whether that's the answer to everyone's prayers. I think the answer to everyone's prayers is going to be changing lifestyle and changing diet and checking your saliva quality. And these are things I want to hopefully get time to go through for your audience, because I don't really want people to think, oh, they must just get one toothpaste and that will be it. That's all they need. There's a protocol and a journey before I feel we're going to get optimal oral health. But there are some quick fixes. So in the mainstream medical world, if you're super infected, you just dump in a load of antibiotics, antiseptics, and great. You cut your arm and you're bleeding, and you may have some dirt in there. You're going to have some iodine put in there. You're going to have chlorhexidine put in there. You're going to have all these kind of bleaches put in there to disinfect. Well, there are plant versions of that too, right? So my favorite is cloves. I love cloves. I chew cloves daily, and one of my kind of pet kind of fun things to say to patients is, if you just chew a clove a day, maybe you'll keep the dentist away. I'm only saying maybe, like maybe if you eat an apple a day, you'll keep the doctor away. So I think there are some foods out there that just kind of just get the body more balanced more quickly. And there are plenty of foods that get us out of balance. So we've got to be careful if we're going to have all these other foods, the alcohols, the cigarettes, the fast foods, the ultra processed foods. I think if you're going to be living on that stuff, maybe you need to live on the mainstream kind of more toxic kind of products, because you're getting what you deserve, or you're having to take what you deserve. Whereas as you clean yourself up, you then attract a higher vibrational method of your healthcare, if not your sick care. Maybe initially in your sick care, you have to be a bit more intensive. And then for your healthcare, it's just a low maintenance program. Just keep doing it twice a day, whether it's flossing, there's certain toothpaste, a water floss, checking your saliva. I'm very strong on checking the pH or the acidity or alkalinity of your saliva, because you can be doing all these amazing things. If you're still very acidic because of your diet, then you've got to look at ways to alkalize your mouth. And there are foods that can do that, and then there are liquids that can do that. And the liquids that we all know about are salt water, bicarb of soda water, celery juice, just aloe vera juice, plant extract juices that are not citrus, that are very alkaline. And you can just daily bathe your teeth with these magical liquids, these kind of alkaline liquids. And one of my biggest fun things to say to people is, most people don't know that when we start chewing something, our pH elevates by about 2 counts. So if you are acidic, say a pH 5 and 7 is neutral, just by chewing something that's sugar-free will raise your pH. So the mainstream world have jumped on that years ago with chewing gum. So after meals, just pop in a piece of chewing gum and you'll be fine. You'll neutralize your acid attack from your sugary foods. And they're correct, because the pH has been stimulated. The research is all there. And they're promoting kind of chewing gums that are very petrochemical based. There are, again, in these kind of more natural health stores, more plant-based gums. And both organizations, allopathic and naturopathic, tend to be veering towards xylitol, which is like very rich. It's like a sugar alcohol that the feeders that cause tooth decay, which is called strep mutans. It's the big bacteria called strep mutans, which is naturally in our mouth, but it increases in numbers as the sugar levels increase in our mouth, and maybe also when the bacteria protection systems fail, especially if we have a dry mouth or an acidic mouth. So when these strep mutans start to proliferate, they can be controlled with flossing and brushing, etc., and more alkalization of the mouth. But this one wonder sugar alcohol that's been really pushed now, because it does work. It's feeding another industry, right? It's another kind of food industry. It's the xylitol industry. So you can buy xylitol granulations, it's like an extract from silver birch. That's how they found out this product in Finland. It was finding in Finland 50, 60 years ago, and has just increased and increased because we're not solving the tooth decay crisis. And certainly fluoride is not stopping it. It's maybe reducing it a bit, but it's not stopping. It hasn't eradicated tooth decay. So we're looking at other ways of eradicating. And on many levels, xylitol makes sense. And it's actually in strawberries and raspberries, for example. So there are dentists now and oral health advisors saying after a sugary meal, just enjoy a strawberry or enjoy a handful of raspberries, which I think is lovely. That's a lovely idea. I'm still a fan of, like I said before, when we're off the internet, eating raw foods like carrots and apples. Even if they're slightly acidic, they will be cleansing the teeth and just scrubbing away the plaque and keeping the strep nutrient levels low because they live in the plaque. And plaque is that furry stuff. It's the glycoprotein that when we wake up in the morning, we lick our teeth and we can feel it's furry. And overnight, it's grown. And sadly, if it's full of strep mutans, which is this bacteria that causes tooth decay, then we are much more prone to tooth decay than others. So that's why some people who maybe don't brush their teeth are not getting cavities, not because they're not eating sugar. It's because they don't have a very high concentration of strep mutans. So it is actually a bacterial infection, a bacterial disease, which I don't think a lot of people know. They just think, oh, it's just because I'm eating too much sugar. So it's even communicable off toothbrushes, kissing, etc., etc. And it's interesting, in clinical practice, we often see people with tooth decay and gum disease as partners. They both have it. It does get passed across if you are intimate and you're not sleeping in separate beds. So going back to foods and herbs, I'm a massive fan of chewing a clove. I genuinely would love to do a trial on people who don't brush their teeth but chew a clove a day versus people who don't chew a clove a day but brush their teeth. See what the difference gum bleeding scores are, tooth decay kind of risks are. But it's so difficult to do these kind of studies because it's got to be done over years. Tooth decay doesn't happen overnight. Gum disease is the easiest one to check because that can happen within a day or two. You can get inflammation of the gums within 24 hours, 48 hours. But true gum disease does take a lot longer. And that's months, if not years, to really start eating into the bone. And going back to foods again, and because you've studied plant medicine in particular, when we were in medical school, there were two products that were really potent in dentistry. One was eugenol, and it was in nearly every dental product. And you even went, I don't know if you're old enough to remember going as a child to a dental practice, and actually you could smell the oil of cloves, which is eugenol. The oil, the essential oil is called eugenol, was literally in every dental product. And it was like a lining product to go underneath metal fillings, and even as temporary fillings, it'll be full of eugenol just to take away the pain and reduce inflammation. But then, I don't know if you remember, you used to get like a glass rinse, and it would be red. And the product was called Thymol. And there's even a toothpaste called Euthymol, which is very popular amongst gum specialists. And that's because it's basically derived, that's the essential oil or the kind of phytochemical of thyme. So just cloves and thyme. So just look at your spice cupboard and you'll be amazed how many dental products are in there that could be controlling your oral biome. There's cinnamon, sage, and a lot of people in many kind of herbal worlds, especially the Ayurvedic, ancient Indian kind of worlds, will say, and Chinese medicine will say you can make teas out of these products. And you can, one, systemically cleanse yourself and balance your gut biome, which will balance your oral biome. But also maybe before you swallow, something I recommend is you use it as a mouth rinse, or you put it in your water flossing tank and jet wash your teeth with the phytochemicals of all these beautiful plants. And oregano, or you may say oregano oil is seen as the gold standard antibiotic amongst herbal medicine now. So potent. And there's a bit of a fight between that and olive leaf extract. Olive leaf seems to be really potent in getting into the lung. Seems to be one of the few that can get into help with lung infections. So as a shamanic practitioner, meaning someone who's much more passionate about ancient ways and more looking at the trinity that affects us from the mind, the body, and the spirit. How can we look at all three of these aspects, these very important points of the trident, to give us balance and health and move away from dis-ease? And we're really focusing a lot on the physical. And I think that's what really a lot of holistic dentists really do. Functional dentists might look at a little bit more of the emotional aspect as well. They kind of attitudes. Homeopaths certainly do. They'll look at their kind of mental patterns, shall we say, of their clients or patients. And I've got this calling for many years. And it was ever since I had this near-death experience, I woke up very different. And a lot of people said that my hands had healing energies. I could see things. I was very much more getting more in touch with the spirit world. And then I looked at tribal life and how a lot of their ways connect with the spirit world and their ancestors, and how they use guidance from their ancestors for their healings. And there's even tribes that have found formulas from forests via their ancestors talking to them in dream states, etc. And whilst through my travels, I might have scoffed at that or laughed at that because I didn't understand it. Now that I have some kind of vague understanding, I can't scoff at it anymore. And I feel very sad when people do scoff at it, because I was there once, and it's really hard. It's like trying to describe the color purple to someone who was born blind. So I feel like I was born blind, or I lost my blindness at a very young age, and then I opened up my eyes, my kind of third eye, my pineal gland, during those experiences. And then ever since then, it's just escalated. And I've been following shamanic pathways, trainings, as well as conventional ones. And it all started with kind of hypnosis and hypnotherapy to help people who are afraid of the dentist and teach them self-hypnosis so that they wouldn't be anxious before a dental appointment. Even help people have teeth out without anesthetic. They're usually very good meditators or yogis, and I just facilitate their meditation to a deeper level so that we can do non-anesthetic procedures. And just when someone's a lot calmer, if not in hypnosis, then they don't need as much anesthetic or any anesthetic for smaller procedures. So I had this journey and path of moving certainly away from the physical, then into the emotional, and then into the spiritual. And now, hitting 60, I feel I'm hitting my wisdom years to share insights into how we can intertwine the whole mind, body, spirit connection. And not necessarily just work with ancient ways, because there are some amazing modern ways that are coming through to help us mentally relax. So all these kind of headsets and brain frequency devices to get us calmer. You only have to go on YouTube and you can watch solfeggio music and tones and some beautiful fractals. And so there's a lot of sound and vision stuff on the internet that will just calm us down. So that's modern. Go back to the ancient ways. That would be in a drum, a rattle, some movements, some dancing, which we also do in this day and age. So we can work with the ancient ways and the modern ways and still be called a shaman in many ways. There's just modern shamanism versus ancient shamanism. And what is shamanism? To me, it's just a way of connecting ourselves on a very deep level, working with the mind, body, and spirit in a way that we are so interconnected that we realize that everything has consciousness, everything is talking to us, everything is guiding us, if we just had the ability to stay calm and listen and receive that information. And that's what I'm hoping your audience will get today, is they're not going to get the quick fix. So you must take xylitol, you must take sugar-free gum, you must use a water flosser, you must floss, you must use a fluoride-free or fluoride toothpaste. There are some kind of golden ideas out there, but really my big message is start to take more responsibility. Because I feel just by people listening to this, and even having listened to where we're at now, if someone is still listening, they're taking responsibility because they're getting information that is potentially going to transform their life. And it's not my information. I'm just a speaker of many great teachers that have given me my knowledge. And some of those teachers are nature. I've had the ability, thankfully, I think, by getting off grid 35 years ago, going traveling, getting into nature, hanging out with shamanic tribal life, and then continuing that over 35 years. And it was very difficult during very stressful times of my life. And I'll be dipping in and out of it because I'm running a dental clinic, having some health challenges, et cetera, et cetera. But I feel like I'm in a place in my life right now where it's just coming together, that I'm now becoming a kind of a wisdom teacher, like an elder. I was told off by one of my shamanic teachers recently. She said that you won't be an elder until you're 70. So you've got 10 years of giving wisdom to people before you can call yourself an elder, which kind of reassured me. I thought, well, okay. I thought maybe I'm an elder already. I'm a bit old for my time, but I'm comfortable with that. So I've got 10 years of just sharing knowledge and wisdom. And that's why I'm on podcasts now. And a lot of what we're talking about is going to be on my portals. So people who are listening today, if they're interested, they can go onto portals. But if you've got some specific questions, I do want to answer them. You asked me offline about talking about floss and water floss. And that's a big passion of mine because I haven't really touched on the subject of saliva. And I'd love your audience to walk away with at least this nugget, because I feel one of the reasons we're seeing an increase in disease at the moment in their mouth is more and more people are drying in the mouth. There seems to be a saliva drought amongst many people for many reasons. And so there's 3 key reasons. Stress is the most obvious one. If you're about to give a speech and you're not confident in public speaking, you know that your sympathetic system is kicking off and drying you out. So stress, chronic stress, as well as acute stress will have you dry. So if you're, and I'm not talking just about emotional stress, I'm talking about immune stress, psychological stress, environmental stress. If your whole system is in shutdown mode, it's going to show up in the mouth as a dry mouth. It's a lot to do with the vagus nerve, which is the 10th cranial nerve, and we'll touch on that in just a moment, because there are shamanic ways to improve your vagal nerve health. So please ask me that if I forget. And that is, number 1 is stress. Number 2, I feel, is medication related. I've just seen a massive change over 35 years in my patient base. They used to come in, I used to ask, so do you take any medications? I had an antibiotic last year. Occasionally take a headache pill, an Advil or whatever, but that's it. Nowadays, it's like I'm on this, I'm on a thyroxine tablet, I'm on diabetes medication, heart medication. It's quite a rattle list. We're not just talking 80-year-olds, we're talking 40-year-olds. It's quite shocking. So the age it's starting at, let alone anxiety medication. Yeah. So if someone's already got anxiety and has got a dry mouth, then they're on anxiety medications. Do you know what that does? It dries the mouth. So anxiety medication, another kind of big challenge. And then the third one, so we got medications, we got stress, and then the third one is mouth breathing. So with our mouth constantly open, to me, that's like being on a boat on a windy day with your t-shirt off. You've got all the elements. You've got the wind and the sun just beating down on your skin, and you're not putting oils on your skin. You're not protecting your skin in any kind of way. We all know what's going to happen to that skin. So the same thing's happening to our mouth. And we're seeing so many people. You have to look along a shopping mall or what have you, and you'll see a lot of the youth today just with that kind of gaping mouth and like a drooling long face. And they're looking fatigued, their heads down, they maybe have a mobile phone in front of them, and they're just walking in that stoop and that sort of gormless, open mouth face. Why is that? And there's a whole list of reasons why that's happening, from the orthodontic disorders and problems that we've talked about. Then we've got glandular kind of problems we've talked about, chronic fatigue, and maybe the tonsils are constantly swollen, so the airway's limited. So it's really hard to just breathe through the nostrils, especially if there's congestion in the sinuses. So there are some physical reasons why people are favoring the mouth rather than the nose. But one of my teachers, my Buteyko method teacher, said, think about it, there's 2 holes here, and there's only 1 here. And this is for eating, right? Maybe drinking as well. But what we've got 2 here, it's more important. We can live for how many days without food? We can live for how many days without water? But we can't live for very long without air, right? So those 2 holes are super important to get oxygen, one, into our lungs in the most effective way. But here's the kicker. Those hairs in our nostrils that we like to pluck out because they don't look so sexy are our filtration system. So we're getting pollen challenges and we're breathing straight through the mouth. We may be getting pseudo asthma or being told you got asthma when actually you haven't got asthma. You just got allergic rhinitis because of the fact you're mouth breathing rather than nose breathing. So we hit another big subject, which is all the kind of breathing disorders just because of breath going through the mouth rather than the nose. And I can give a whole podcast on that, but I just want to bring it back to dry mouth. So we've then got a dry mouth from that. Now, if saliva is this golden magic fluid, this elixir for oral biome health, then aren't we in trouble if we're a species growing more and more into mouth breathing, medication use, and stress, and we're just constantly just having a dry mouth? If that liquid is the elixir, the kind of the antidote to gum disease and tooth decay, wow, we need to treasure that fluid. So there are things that I teach, and I've done many a blog and want to do specific podcasts over time on the top 10 kind of strategies on what to do to prevent or reduce dry mouth and to re-salivate the mouth. So we've touched a little bit on sugar-free gum, not anti that, chew a clove, but my favorite is that it's going back now to the shamanic way. And the only way we're really going to take responsibility for our health, whether it's our dental disease or our general health disease, is that we start to get back into our bodies, get centered, take responsibility, and own that we're in trouble, and own that our house is on fire. And I think the people who just keep popping the pills, and I've been there with headaches. I used to pop pills when I went to work, wasn't owning the problem that I was drinking too much the night before or didn't get enough sleep. And I'm different now. I've grown and taken responsibility, and I've started to calm down a lot more, and I'm seeing a much happier, healthier me. And when you start to calm down and get healthier, you start to become more aware of where it's not functioning. So if you get told that you are dry in the mouth, the first thing I would say to my patients when I see with dry mouth is you need to get aware how dry you really are. And when you know how dry you are, it's a bit like if you've got flaky, dry skin, you're going to put some cream on there or some oil on there if you care about your skin. So if you know you're dry, yes, you could sip some water, but all you're doing is putting water back in the mouth. So a lot of people say they do that in the night. They wake up dry. They have water by their bedside. So fantastic. And some people have oil. Some people put a bit of olive oil in their mouth, a bit of sesame oil, a bit of coconut oil. Fantastic. They're like lubricants. They're antiseptics. They're all great strategies. But number one strategy is getting that saliva back. It's got to be, hasn't it? Because that's the liquid that we're missing. So when we're aware, it's a bit like breathing. When we're aware that we're shallow breathing, we can teach ourselves to breathe more deeply. And then we can play with breath work and different forms of breathing for different purposes. Let's get aware of the fact that we're quite dry in our mouth. And then we just override the swallow reflex. Because it seems like the swallow reflex happens every 20, 30 seconds max, maybe 3 or 4 times a minute, even when we're dry. Because it's like a reflex. It's like you got to keep swallowing. So just stop swallowing, override it with mental control, get aware, and then hold back the swallow and allow the saliva. If you're dry, it means it's flowing slowly. There won't be zero saliva unless you're really unlucky, and that's very rare. There is a disease called Sjogren's syndrome, an autoimmune disease that will affect the saliva glands. But even those people can stimulate some saliva. But it's not a lot, and it's pretty grim. It's not something you want to wish on anybody. So with just the holding back the swallow, you allow whether you stimulate that saliva by putting a clove in your mouth or some xylitol in your mouth, or you just let nature bring it on. Just let it flow into your mouth. And then when you've got a good mouthful, so when you buy a bottle of mouthwash, it's a capful, isn't it? So what is that, 10 mil? Not a lot, just one capful. It's enough fluid to swish around and maybe gargle. You want 2 capfuls to gargle the back of your throat. So if you it's going to vary from person to person, depending on your flow rate. But by holding your lips together and not swallowing, you will allow that fluid level to rise. And then when it's a good mouthful, then you can just work it around for as little or as long as you feel is necessary. To me, the longer, the better. It doesn't have to be for hours. It just be enough time for you to feel like you've spritzed it between your teeth like a human water flosser. So my teaching for a human water flosser is you keep your lips sealed and you build up a hydrostatic pressure with muscles for your masseter muscles and your buccinator muscles. And you spritz, you can feel with the lip seal, you're creating a jet, just like a water flosser does, in between your teeth. And if it's not getting right through your teeth, it's really flushing and neutralizing the pH, which may be acidic, because by being dry, the pH will have dropped down to a more acidic level. And then that saliva hopefully will be rising the pH to reduce the next subject, which is erosion and tooth decay, because erosion and tooth decay come from demineralization. It's not just because of sugar and just because of bacteria. It's ultimately losing of calcium and phosphate from the teeth. And that only really happens from acidity, so erosion. So if you've got a gastric disorder, like a reflux, we can see that. Or if you're a bulimic and you're creating your vomit for your weight loss reasons or whatever your personal disorder is, that acid reflux is seen as erosion on the inside of teeth. So we can diagnose a bulimic just like that. And when we see the inside of their teeth, not necessarily the front of their teeth, but the gastric reflux is washing on the inside of the teeth. So we see it on the inside of molars and on the inside of incisors. So again, if you're rinsing and washing with saliva, you're going to neutralize all that acidity. So you're going to reduce the risk of erosion, reduce the risk of tooth decay. Whether you can eradicate it or not, that's case dependent, and that's going to need clinical supervision and clinical guidance. So going back to my waiver at the beginning of our talk, where like a disclaimer, I really want to urge everybody to find the, not necessarily shamanic dentist, because I'm a bit of a quirky dentist in many ways, and I won't be everybody's flavor, a bit like a Vietnamese restaurant rather than a Thai restaurant. You know what I mean? I've got my flavor, but ultimately I'm a spicy restaurant. So there's Indian restaurants, there's Thai restaurants, there's Vietnamese, Mexican, etc., etc. So every dental practice or dentist will have their kind of flavor. But as a dental restaurant, we offer all forms of food, right?
Hey, I just wanted to jump in here and interrupt the program for just a hot minute. You know that I'm so passionate about this podcast, but what I'm also really passionate about is helping women with lupus minimize their symptoms, boost their energy so that they can indulge in life again. So if you are a woman who is struggling with lupus, who is sick and tired of being sick and tired, who's struggling to manage your flares, if you're finding that your lupus symptoms are just really getting in the way of you being able to live your life the way you want to, I feel you. I've been there myself and I felt the same way. And what I've found is that there are a certain set of health fundamentals that once applied will support you in your foundational health. They will support you in building and maintaining that energy, minimizing flares, and allowing you to, again, indulge in life and follow your passions. So if that is something that you are interested in creating for yourself, let's jump on a call together. I will walk you through the process that I use with my clients to get them from sick and tired to strong foundation of health by implementing my HealthBridge protocol. If this is something you're interested in chatting more about, I would love to talk to you. Apply for a free clarity call with me, and I look forward to getting to know you soon. And now back to the episode.
So we all also offer the mainstream stuff. And where they overlap is that we monitor the same, or we should monitor the same. So when you come for an examination, you should be looked, in my world, how we were trained. And unfortunately, I'm not seeing that in clinical practice so much anymore because of speed and fiscal pressure. Because, for example, an examination can be 10 minutes. It could be an hour if you're doing all the kind of checks that you need to do. So some dentists will only book an hour and charge $200, $300 and be out of most people's price range. So they drop it down to 10 minutes, 15 minutes, 20 minutes, and just charge 30, $50 because it gets bums on seats and it helps them then start a conversation. So and that's okay if someone's super healthy, right? If someone's super healthy, they just come in 10 minutes, yeah, no cavities, no gum disease, out you go. But if someone's suddenly, wow, you're in big trouble, at least someone's can then be brought back to maybe see a hygienist, or maybe for what we call second records, some deeper records where you're then going down the rabbit hole of oral health to another level. And we could touch on it. I don't know how much longer we've got for this podcast. But so there is a checklist of things that don't get routinely done, like saliva pH. I don't know many dentists and hygienists who even just check a saliva pH. It's just a little bit of paper, but I like to encourage people online now. It's just not necessarily something that is necessary dentistry. So I don't feel I'm saying something inappropriately. There's no reason why you can't check your own pH. Doesn't mean you can then diagnose from that, but then you can go and tell your dentist, look, I've checked my pH and I'm like pH 4. It's like, really? Is that why I'm getting yellow teeth? Is that why I'm getting cavities? Is this, and maybe educate dentists into doing pH testing. You can even get a digital meter to check your urine, to check your saliva. And you just literally put this probe into your fluid and check the pH. So that's one thing that's rarely done. And if you're not really seeing a hygienist or hygienist, You won't be getting the blood bleeding scores, the plaque kind of concentration scores, and the depth of pocketing. And it could take half an hour to go around every tooth. So you tend to go to periodontists when you've got periodontal disease for these deeper measurements. But maybe it'd be a good idea to do that from the very beginning. So you're getting the deepest, best possible screen check that you can have for your mouth. And they will even go now to salivary diagnostics, where very simple, and you can actually buy these off the internet as well and just do a spit test, and it will actually give you really good information on the biome of your mouth. So if you are predisposed to tooth decay or gum disease, which are the pathogens or the organisms that are growing? It'd be best done in a dental practice in my world, but it's not impossible to do yourself. And a lot of these companies sell off the internet to help people explore, not necessarily to treat themselves. I don't want anyone treating themselves, but I don't see why people can't test themselves without seeing dentists and get some more information about themselves. So that kind of then helps people discover by being more, taking responsibility, owning their disorders. Then they're armed with information to go to a practitioner. And if that dental practitioner is someone who just doesn't want to know, you're not on their frequency, you're not on their wavelength. So should you really be having that discussion? And maybe it's wise to do an internet search of a dental practice that's open to that kind of stuff. So there are dentists out there. They're not the majority, but there are dentists, and certainly in San Diego and California generally, there will be many holistic dentists. But one of your key questions, I want to end on this, is please open your eyes. And something I urge all my tribe, and that is the word holistic is being used so much in marketing of products. And you read the ingredients of these products, and you think, where's this word holistic? Oh, they put some coconut oil in it, but they still have every other chemical under the sun, but they're allowed to call it holistic because they've got some coconut oil in there. So there'll be dental practices that call themselves holistic. And I would just say, open your eyes and just ask some decent questions, either online or face, to find out if they're the right practice for you, or if there is a practitioner in the team that's right for you. Because often you'll find there'll be one practitioner. That's how I've been for many years. One practitioner in a multi kind of practice that offers a whole range of services. Because ultimately, dentistry still is a surgical scene, right? And it's a cosmetic scene. So the holistic member of the team can still be within a group practice, but you need to find out if they resonate with you. And I think it's really this. I say this, I don't know if it's like this in the States, but in the UK, you used to just always go to the dentist just down the road. When certainly I did growing up, you never questioned your dentist, and you never really moved out of the area for your dentist. But we do that now for restaurants. We do it sometimes for hairdressers. So why aren't we doing it for our dentists? Going back to taking responsibility, what kind of dentist do I really want in my life right now? Whether you're happy with that dentist or not that you currently have. And if you are happy with that dentist, this is my favorite subject, is you actually then approach that dentist to see if they're going to scoff, or whether they're going to be open to listen, and have they got the compassion and the willingness to say, I don't know, but it sounds interesting. Let me look it up on the internet, or let me speak to this dentist that seems to know what he's talking about, and then grow from your conversation with that dentist. Because if you've got 20, 30-year relationship with a dentist, it'd be a shame to have to move to somebody else, because they've probably got great hands and great skills, because that's why you're still their dental patient. So that's one of my missions, is to encourage more dentists to open their mind, not necessarily to be 100% of a holistic dentist, but to be much more open to the possibility of helping these patients. Because who's looking after these patients? And that's what worries me, is I think a lot of these patients are not questioning, and they're just putting up with a service that they're not happy with. That's like eating a meal that's cold or not spicy enough or whatever, and just putting up with it and still going back the next time because it's convenient. It's just down the road. So seems like we're going to have to wrap up shortly. So is there any last question you want to ask me? But my main feedback is I've written a lot of blogs on my website called the Dental Shaman, or shaman.com. And it's still a young website, and I've got so much to give. And I'm very old doors on one level, and early doors on the kind of modern way of communicating through podcasts and websites, etc. And if people want to ask me questions, some of it I charge for, if it's like clinical consultancy. If people just want a quick question, a quick thing, I'm always online just replying to these people. I do it a lot on social media, so building a big following on Instagram and TikTok in particular. And then people are always asking me questions, and I just do it in my free time. It's just something I love to do from my heart. But if it's a deep question, or even a consultancy, like send me your x-rays, send me your photographs, send me your CT scans, then I can price it out as a consultancy like anybody else would give a consultancy. And that's something that's becoming very popular. I think just having a portal of this kind of conversation with someone who understands them, and it could be from a spiritual level, it could be from an emotional level, or it could be this biocompatible, biological level that we've talked a lot about today. So yeah, I could talk forever. You know that. I think your audience will know that.
Yeah, we should maybe consider having you back for more discussions. A couple things that I just wanted to go back and touch on what you were just talking about choosing a dentist. I think it's the white coat syndrome when you're at the doctor and all of a sudden they're the authority. You're just the person that doesn't have the expertise. It's easy to just get drawn into whatever course they tell you to do without questioning things. Yeah. I think it's even more so like that with dentists because it's even that much more removed from our mouth is open and we can't talk, right? But it's even that much more removed from our like daily lives. Like people might study health out of curiosity. They're not really studying dental stuff in their spare time on Google. So I think finding one, like you said, that is willing to have conversations with you and listen is really important. I know at least here in the States, we can be really tied down by whatever health coverage we have, and we might not have a lot of options. So what I love about what you do is that you offer like second opinions and consultations. So that is another way that we can bounce off. Like, I feel like my dentist is just trying to sell me on more procedures. What is your opinion? Or I'm just not sure which way to go with this situation. So having that option, I think, is really important. And that's something that you can do worldwide. You don't have to be in my town for me to access
you. From a beach in San Diego. We'll do it from the beach.
Oh, yeah. We could set up a clinic. I'm happy to do that. But also what you were saying earlier about taking responsibility, one of the big talking points that I have with my clients and on my platform is taking radical responsibility for your life overall. And that's not always easy to do. I'm sure I've got plenty of blind spots still that I'm not fully responsible in, right? But that's the path of life, is like finding those blind spots and stepping up again and then stepping up again for yourself. And so
it's a journey. It's a
journey. Yeah. So I just want to reiterate what you said and invite our listeners to take responsibility. Don't brush it off as like, oh, it's my teeth. I don't have any control over what's going on there. It's like, no, we actually have a lot of control. Sometimes we need outside help and reinforcements, but we can choose to care for ourselves in positive ways. We can choose to look at our lifestyle and see how that has played into our current situation, look at our past choices to see how that's played in, or we can keep the blinders on and just hug it off on somebody else to fix for us, or it was somebody else that caused these things. So it's really up to each individual how they want to approach life. But I think there's so much more freedom and empowerment in approaching it from this more holistic, shamanic, primal perspective of, hey, we've got this one life. How do we interact the best with the world around us? How do we interact with ourselves on a mental, spiritual, physical level? And how do we bring more joy into our lives? Because it really comes down to that, right?
It certainly does. And I think it'll only come when we are committed to heal. And it's the expression, I surrender. I think when we are on our knees and we just ask for help, that's when we show up for people. That's when people have shown up for us, when we've been asking for help. So that's why we're here. We're both very aligned, I feel, and that's why we're talking together. And just our conversation will hopefully empower other people just to ask for that help. And it could just be a simple yes or no question or a very deep kind of journey. Maybe I can trigger via contacts in the US or around the world. There's plenty of networks that I'm affiliated with that I can guide people to. There's so much information, and I'm really struggling to get it all out there. I'm hoping I attract an admin type team, even an IT team over time. It's just that a calling that I'm actually calling my second dharma. So the clinician, the hands-on kind of guy, is taking a step back, and I'm setting up a sweat lodge center in an island just south of England this summer or end of summer, and not just dental patients, but anyone who wants to heal will be attracted to that center. And it'll be a healing center as well, a yoga retreat space, and kind of men's group space, a foraging space, a wild space, with the crux being the sweat lodge, because that to me is so important. And one of the biggest ways to heal is to sit in darkness and to be in extreme temperatures and sweat and be in a community of other people who are willing to share their heart and soul. So I'm a massive fan. A lot of people do a lot of talking in saunas, right? You go 2 or 3 friends, go and sit in a sauna and talk. It's not the only place to talk. People talk in bars, right? And you can talk anywhere. But I think when you want to talk deep emotional stuff, being in the darkness, being in the heat, being in the primal scene of the shamanic way, what our ancestors taught us, and it's modernized with saunas, but take it back to kind of more earthly saunas where you're out in the fields, in the forests, and using hot stones and foliage and just being on Mother Nature, on Mother Earth. Maybe this whole grounding thing that people talk about, walking barefoot, has so much power to be anti-inflammatory. Maybe just sitting, lying on Mother Earth has this huge healing power that we don't really fully understand yet. So take off our rubber shoes and get the electrical circuits firing. It's another big subject of mine that I'm passionate about that we won't really touch on today. I was going to mention one other thing about primal. What was that? So, we didn't really touch on fasting. So let's end on fasting, because if you are getting tooth decay and gum disease, if you stop feeding this Strep mutans and other microorganisms, the glucose and the starches and the sugars, then these creatures are going to die off. And that's when the biome starts to balance out. So even if it's just intermittent fasting, I'm not talking about 5-day kind of air fasting or breatharianism or anything like that. I'm just talking about just the 18-6 kind of intermittent fasting. I don't know if there's been enough research yet done on the drop-off rate of Strep mutans when one fasts and when one doesn't, but it's certainly an idea that I would say could be effective. Just like chewing xylitol seems to have a way of reducing the numbers of Strep mutans, just having less glucose in the mouth. And this is where I'm definitely going to end, is cut out the snacking on those kind of foods, because we're seeing chips, crisps, crackers. Everyone's nibbling something that's starchy these days, whereas the ancients didn't. If they did chew something, it would be a bit of dried meat, a bit of biltong or a bit of whatever, jerky, whatever you want to call it, and maybe a berry or a piece of fruit that they picked off a tree or something like that. So that's the end of my piece for today, I'm afraid. It seems like I'd love to talk for another hour. I'm happy to come back another time, and maybe with a specific protocol. I've been synthesizing my own protocol, and I'm putting it into an app. So I'll be happy to share that one day, just like a 10-point action plan of do this, do this, do this. And it's not necessarily going to be the answer, but it's like some kind of guidance journey other than just what we've talked about today, which is like a smorgasbord of ideas. Maybe even just a taster. I think today has felt like a taster for your community. Just, wow, there must be something in this. And all these kind of health ideas for the rest of the body also seem to have an impact on the mouth, because they're definitely going to have an impact on your saliva and the oral bio.
I would love to do that. Let's schedule that once you have your app ready, because I'm all about the simplification for people. If we're so busy this day and age, we've got so many distractions. The more we can simplify things and take them back to the roots of the health fundamentals and give them some guidelines, like the easier it's going to be for everybody to follow. So I fully am in support of everything you're doing. You blessed us with so much amazing information today. And Mark, I look forward to more conversations in the future with you.
Oh, bless you. Oh, been a joy. It's flown by, hasn't it? It doesn't feel like 5 minutes.
I know. I look forward to next time. Thank you so much for being here.
Thank you, and all the best, and lots of love to your tribe.
Mark said that we could talk for 20 hours on this stuff, and I have absolutely no doubt after that hour with him. He is a wealth of knowledge, and we see a lot of things very eye to eye, and definitely I'm looking forward to having him on again for another great conversation. One thing I really wanted to actually circle back to that he was talking about towards the end there was the 3 things that he sees leading to dry mouth, because I find these three things also, especially the first one leads to the second one, can lead to the third one, can lead to autoimmunity. So he's talking about dry mouth, and he said the first indicator that he sees is stress. I've certainly seen with so many people that I've spoken to within the autoimmune community, within the lupus community, and definitely seen firsthand for myself that stress is stress/trauma is like a definite root cause for developing lupus and other autoimmune diseases. Second, he listed medications and just the stacking on of medications following the periods of stress. The stress is causing inflammation and physical changes within the body. Those changes, oftentimes we go to the doctor, we're not tying it in necessarily with stress. The doctor is not necessarily tying it in with stress. We're just looking at the symptoms and what pills can we take to fix or alleviate these symptoms. So we go down this path of prescriptions for better or worse. Sometimes they help, sometimes they compound other issues, right? So we end up on medications and it's not curing the problem. There's still things underlying, and we still have that stress because we never got to that root cause yet. And from there, he lists mouth breathing. I don't know per se that mouth breathing is necessarily been studied in terms of is it tied in with autoimmune conditions or not, but I know that it is well studied to have indications on overall health. And when you are mouth breathing, it can cause other ripple effects towards ill health. So you put all these things together and you realize that things are so correlated. These symptoms aren't just about culminating in dry mouth, they're also about culminating in just deteriorating health and potentially autoimmunity at the end of this. So the more we are aware of all these little things, the more we are aware of how important it is to learn ways to manage stress, the earlier we can stop these things from really taking root in our body, in our mental health, in our physical health, in our spiritual health. And we can stop the major issues before they start, simply because we can become aware of the stressful situations, the things that we don't have control over in our life, but we can control how we respond to them. And when we have good tools to respond, that is how we can maintain good health. So I just want to leave you with that thought. And as Mark said, he is very open to answering questions, and he also does his online consultations as well. I am super happy to have that as an option for me moving forward in my dental future. Have a second opinion that I know I can trust. So please reach out to him. All of his contact information is below in the show notes, and reach out to me if any of this rang true for you in your health journey, in your autoimmune and lupus journey. I would love to chat. I would love to see where you're at, and let's have a strategy call and see what we can do to up level your energy, to minimize your symptoms, and to just be able to get back to living a more full life. Thank you so much for tuning in, and we will see you on the next episode of the HealthBridge podcast.